Today was day one of a face mask mandate in Massachusetts, a rule that may be with us for a long time to come, according to Governor Charlie Baker.
We view this as a common sense way to set a statewide standard for the long term as we look to get back to a new normal. No one quits, no one stops, no one slows down in the fourth quarter.
As for what we can expect in the weeks ahead, the governor was cautiously optimistic.
Our goal, starting on May 18, is to begin reopening certain types of businesses in a limited fashion. But this phased-in process can't begin until we see sustained downward trends. And I've said many times that coronavirus, COVID-19, is a novel virus, and therefore we don't have a lot of history about how it works or what path it will choose to take, and therefore it's very risky to make broad prognostications about what's going on, where it's going, how it's going to get there. So much of what we know about this virus has changed in the last 60 days.
Or even in the span of 60 minutes when it comes to the White House's plans. Yesterday, as you'll recall, the president was ready to phase out the White House coronavirus task force by Memorial Day. Today, he's looking to add to that team and says that it will continue indefinitely.
I thought we could wind it down sooner, but I had no idea how popular the task force is until actually yesterday. When I started talking about winding it down, I'd get calls from very respected people saying, I think it would be better to keep it going. It's done such a good job.
The president did also say the task force is shifting its focus to opening up the country again. But at a hearing before a House committee today, a senior researcher at Johns Hopkins University, which has been keeping track of cases and deaths, testified that we're just not there yet.
There are 4 criteria that states should meet in order to safely reopen. To my knowledge, there are no states that meet all 4 of those criteria.
And in that same hearing, Tom Frieden, he's the former director of the CDC, he testified this.
Sadly, looking at the U.S. as a whole, just calculating forward from the number of people whose infections have already been documented, there will be, tragically, at least 100,000 deaths from COVID by the end of this month. As bad as this has been, it's just the beginning.
I'm joined now by Dr. Vanessa Kerry. She's director of the program in global public policy and social change at Harvard Medical School and the CEO of the nonprofit Seed Global Health. Doctor, it's good to see you again. Thanks for being here.
I'm delighted to be here.
Can we start locally and then we'll step back a little bit? I know you spent a lot of your time in the last several weeks doing your practice in the ICU, I think as recently as yesterday. What's the world like in there?
So, I'm a physician at Mass General Hospital, where I work as a critical care physician in ICU. It's a funny combination. There are aspects of it that are incredibly calm, incredibly ordered. Mass General's done an extraordinary job of being prepared for what this onslaught is. And we are serving some of the hardest hit areas in the state, Chelsea, East Boston, where we've really seen what the inequity of COVID can do. And in other ways, it's deeply painful because I am seeing patients, some of the sickest I've ever seen, but so many of them, and all from the same thing. And that part is difficult. And what's also difficult is when you walk out of the hospital, you don't leave it behind because you're walking down empty streets, people are in face masks, and COVID is everywhere. And then you see people protesting at the State House. And I'm just holding my breath waiting for the new surge now that's going to come in 3 weeks. It's, my colleagues are extraordinary, and aspects of it, it's really heartening, and you're seeing extraordinary people pull through and survive. But this all feels very preventable, and that's the part that's painful.
I want to speak about that future you just described. There was a vice presidential nominee not too long ago who talked about 2 Americas, and there are 2 Americas. There are places like Massachusetts, where, as I said, the face covering mandate went into place today. Very cautious governor. And then there are 27 states, I think it is, that have begun reopening. 41 already announced plans for reopening. How much of a risk are those states taking, Doctor?
An immense risk. I mean, in the case of Georgia, they hadn't even started to see a sustained decline. They were still actually rising to maybe best hopes of plateau, which means that you're still having a huge amount of the community be infectious and getting infected. And so to think about reopening is just what it's going to we're just going to be right back at square one. We've seen this in countries around the world where they reopened. They saw, even in the best of cases, they saw a new surge of cases. We also know that this new COVID is very infectious, new meaning that it's evolved from what it was originally in December a little bit. And the genetics look like it's become more infectious than it was originally thought. And, the reality is COVID is going to be a part of our lives meaningfully for a while, if not potentially even always, depending on how the vaccine turns out. And we need to embrace that and think strategically about how we save lives, save the health systems, and work within these new parameters, recognizing it's difficult and recognizing there's a lot to mourn. We had a lot of freedom before in a way that we don't. But this is the reality. And the harder we fight it, the worse off we're going to be. So I'm very worried about those states that are reopening prematurely, that haven't seen sustained declines in transmission, and that don't have plans, don't have universal face mask policies. I think we're about to see them get very, very hard hit.
So you mentioned vaccines. Let's talk about that for a minute. We read that the EU was coordinating an effort to raise $8 billion, a collaborative effort to work towards a vaccine. A notable absentee with no financial contribution was the U.S. Does that matter if we're doing our own work on vaccines?
I think it does matter, because the reality is that sharing of information, sharing of genetic code is going to allow us to accelerate science faster. And we know from our testing debacle that developing our own test may not always work out for us. Mm-hmm. Our reagents were faulty. We fell way behind on getting testing scaled in this country. To this day, we do not have scaled testing. The criteria for getting testing is abysmal, and it's going to be very difficult to control any kind of pandemic in the absence of testing. So I think that we know that we have to rely on international collaboration, information sharing, and we have to do this together if we're going to do it fast, effectively, and in a way that we can get the information we need. I think the most concerning thing, though, frankly, was the signal it sent about our willingness to be a global citizen at a time of profound need, and at a moment when we are globally at our most vulnerable that I think we've been in many ways in human history. And the failure of U.S. leadership is just shocking in this moment. And I think that that's going to be a hard hole to climb out of for years to come, no matter who becomes the president in January of 2021. And so, we're just setting up a harder time for ourselves on a number of levels.
But it appears there is some vaccine optimism, if I can call it that. I mean, a couple of things I've read in the last couple of days. Pfizer and some German company are talking about potentially having a vaccine for emergency use as early as September. And even Dr. Fauci is talking about the possibility of a vaccine for general use as early as January of next year, not the year or 18 months we've heard. Is that false optimism, or is that well-founded?
Well, look, I mean, from my school, anywhere that anything Tony Fauci's talking about is going to be solid. I think he's been very, he's an extraordinary scientist and public health practitioner. And so I think that there is validity to this if we really think that that's the case. There is optimism for a vaccine. There's a number of vaccines that have already gone to human trial that I think people are feeling really good about. And I think that folks are going to be cautious about setting too high of an expectation, at this time. That said, we need to hold our breath until it's said and done. Because there is some signs that the COVID may be changing a little bit, or then we don't know yet if people actually have immunity after they're infected. We're hopeful, but it's too early for us to know totally where we're going to land on that. And that would be an important thing for a vaccine to be effective. It's possible it would be like a flu vaccine situation, though, where you just get an annual sort of booster to prevent it. I think we still are figuring out exactly where we're going to end up, but there is reason for optimism. And I think that we should hold on to that right now. But in the interim, we shouldn't bank on it. We should be doing everything in our power to shut down this epidemic, because we know it's possible. We've seen it in other countries. And I think that we have to keep fighting for that goal as well, because then we're prepared for everything.
But we don't see it in all other countries. A part of the world where your organization has a lot of its focus. I read a story in the New York Times the other day that was just shocking. The opening paragraph went something like this. It said, in South Sudan, there are more vice presidents, 5, than there are ventilators, 4. And it went on to say that in 10 African nations, there is not one single ventilator in the whole country. We only have a minute left, but what's the future look like there?
Well, I think Africa is it's a continent of 1.3 billion people, and the cases are on the rise. We should be very worried because there's already crushing burdens of disease. And Seed Global Health, the nonprofit that I run, we've been partnering with governments there for years to help train doctors, nurses, and midwives in order to ensure that there's that front line to address COVID or every other disease that's been going on. And our needs are only greater in this moment because there's now this new layer of disease coming. But with well-trained health workforce and some investments in infrastructure, it is manageable there as well. 95% of patients don't need ventilators. Mm-hmm. So we can do something for them with oxygen and skilled health professionals and a skilled workforce and government leadership to invest in the health system. And so there should be reason for hope, but there also needs to be reason for action and mobilization. And we need to be doing that in this country. We are watching the inequity of COVID play out here. The communities that have been hit, like Chelsea, 1.8 square miles and 40,000 people, and it's got an infection rate the highest in the country, even over New York State. It's incredible. So our own backyard, Africa, we are in this as a global community, but we have to be engaged, and we can't settle for some people are going to die. We have to fight for every life we can because every life matters.
Here's to engagement. Vanessa Kerry, thanks so much for your time. I really appreciate it.
Thanks for having me.